make sure bed is appropriate to height. Hi, my name is Ajay. I'm a student nurse. I'll go ahead and do your head to toe assessment. So I'll make sure all pre-procedures. Then I will go into making sure I visualize the patient or inspect the patient skin. I'm looking for no edema throughout the whole body. I'm looking for no bruises or lesions, petechiae throughout the whole skin. Upon palpation, the skin is warm to touch, and the skin, the turgor returns to baseline in 2 seconds. Capillary refill returns quickly, and checking both extremities. For IV, I would make sure that the IV is intact, clean, dry, patent. If there was any tubes or drains connected to the IV, I would make sure it's flowing, patent, no kinks, in its proper position. And for any wounds, I would make sure the dressing is dry and intact. And then, so now that I have that skin part situated, I will look at the head. It's normocephalic. It is symmetrical to the body. It's appropriate for the shape. I would make sure to look through the hair to make sure that there is no lice or nodules or lesions, anything in that scalp area. I would move to Perla and make sure that the eyes are round, equal, reactive to light, and accommodate. And then I would look, the sclera is white, the conjunctiva is pink. There's no extra drainage in the eyes. I would check the ears. For an adult, I would raise up. For a child, I would raise down or lower down. I would look in to make sure the bony structures are intact. The tympanic membrane is pearly white or gray. And just FYI, I would flip my battery and make sure my light actually turns on for the procedure throughout this. I'll make sure there's no excessive drainage or debris hanging out the ear. For the nose, it is patent, pink, and moist. No extra debris or hairs or drainage coming out of that. The dentation is intact. The mucosa is pink. The lips are of normal moisture. The neck is supple. The trachea is easily displaced. Then I will go ahead and go down to respiratory. For respiratory, I'm looking. There is no tripoding. There's no retraction of intercostal spaces. There's no use of accessory muscles. Breathing at a normal rate. So speaking of breathing at a normal rate, I would need to make sure that the respiration is between 10 and 20. The oxygen is between 95 and 100. The blood pressure, systolic 100 to 140, diastolic 60 to 90. Same thing for pulses, 60 to 90. I would check for pain and ask, where is the pain? Where is it located? Does it radiate? Does anything make it better or worse? So PQRST for the pain. And those are my vital signs, but I will also notate the height, weight, and BMI for the patient at this time as well. So moving back into the respiratory, I would make sure I've already looked at, inspected. I would listen, 5 spaces in the front. I would go for 9 spaces in the back. Keeping it midline. I will not hold the patient by their neck, but we're just, demonstrating this here. So for the back, I would also percuss each 9 locations. I would listen to tactile firmitus, 99, 99, 99, going down midline. I like to go ahead and check for curvature of the spine, so I would ask the patient if they were standing to bend down, and I would keep my hand and then have them bend back up. I would check for chest expansion, placing my hands on the side, full inhalation, full exhalation. I would check for the CVA, below that CVA angle, and I would palpate on both sides. For cardiac, I will go ahead and inspect, same thing I did for respiratory, but in this part I would do aortic, pulmonic, urge point, tricuspid, mitral valve for the point of maximal impulse. S1 and S2 are intact. There are no heart murmurs or abnormal rhythms. At this point, I've already checked capillary refill. I'll check for a soft touch with the cotton tip, a sharp touch, apparently not telling the patient what I'm using, but just making sure to check for that pallor, pain, paresthesia, paralysis of the extremities. In order to not create a syncopal episode, I would do everything bilaterally, one at a time. So carotid, carotid, brachial, brachial, radial, radial, popliteal, popliteal, dorsalis pedis, pedis to pedilus, PT, because I did not pronounce that right, PT on the mid, inside there, and then popliteal at the bottom, bilaterally. And then I would go, so I've done my respiratory, I've done my cardiac. I would go ahead and go to GI. For GI, I would start in the right lower quadrant because that's where vowel sounds are most active. I would make sure I auscultate first to make sure not to create false vowel sounds. I'm going to listen for 1 minute in each quadrant in a horse-shaped manner. So that's if vowel sounds are absent, it would be for a 5 minute in each quadrant, 20 minutes total. Let's see. And for inspection of GI, no hernias, ecchymosis, striae, or lesions. So I'll auscultate it first, and then I would move into palpation to make sure I'm confirming the things that I just made sure that I was inspecting for. For GI, I would want to ask about any nausea, vomiting, diarrhea, constipation. For GU, I would ask for any frequency, urgency, dysuria, hematuria, or any pain in any of those areas. When upon palpation, of course, I'm asking, are you tender? Is there any pain in each quadrant as well? Then I would have the patient perform a self-testicular or breast exam if they need it. Since I've done the GU, GI, I will go ahead and move to my musculoskeletal. I've already checked for curvature of the spine. So upon each and every, so for head, flex, extend, circumduct, test strength. Shoulders, same thing, up, down, circumduct, test strength. I will go to the wrist, flex, extend, circumduct, test strength. Same things for the legs, lifting, flexing, testing strength. Ankles, flexing, extending, circumducting, and testing strength. Have them push back and forth. I would also ask him to grab both hands bilaterally to test for grip strength. And at this point, I just want to pause my time. Okay. I wanna make sure I got all my things, so I think I'm good.
Or you're on your way out.
Oh, okay, so post-procedure steps, I'm gonna make sure I load the bed to, the lowest, position. I'm gonna make sure to document, I'm gonna make sure to provide privacy, discard of any PPE. I'm gonna do my hand hygiene and document some more once I leave, and thank the patient for letting me do the head to toe assessment, ask them do they need anything, let them know that I'll be back within a certain amount of time. And now I'm done.